nobody's ever been able to tell them what's going on. And now we know that SIBO underlies the vast majority of cases of irritable bowel syndrome. And so when a person presents with those symptoms, I begin to investigate that.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, how are things going? What are we talking about today? I think we have a not-so-stranger with us.
Yes, exactly. Yes, we're talking about SIBO and rosacea. I mean, this is a very common condition that we see in dermatology all the time. And there's a lot of ways to treat rosacea, but one of them has to do with SIBO. So we need to kind of understand that, because I think to a lot of practitioners, they hear that kind of buzzword going around and they're wondering, should I target this? Is this something that's really treatable? Where's the evidence on that? And so maybe we can take a deep dive with a guy who does this all day.
Yeah, I have to tell you, there's not anyone that I would want to talk to more than Dr. Michael Traub. He's a close friend of ours, one of the core folks here at Learn Skin. And because of his attention to evidence and pushing the frontiers of naturopathic medicine with us here. And so he is founder and medical director of the Lokahi Health Center in Kona, Hawaii. He's been practicing there for decades, and he's board certified in naturopathic, oncology, and homeopathy. Dr. Traub, thank you for joining us on the podcast yet again.
Hello, my friends. Glad to be here.
Excellent to have you. And I think one of the reasons Raja and I wanted to have you is just talking to you puts me in the Hawaii kind of mood. I feel like I'm all relaxed and maybe going to go out for a little swim, see some of the fish in the ocean. So thank you for joining us again.
No, wait a minute, Hadar. We told you Hawaii and you were banking on a cup of coffee, and that was what was going to get you to go out there.
Yeah, it turns out Dr. Traub is an avid coffee farmer, but that's a topic for a different podcast. Today we're talking about SIBO and rosacea. So, Michael,
polyphenol farmer, as we like to say.
Yeah.
Polyphenol farmer.
So, Michael, why don't you give us an introduction to this concept? What is SIBO? Why should we test for it even? And then we can move forward with this kind of building blocks.
Okay, well, as my little Yiddish grandmother used to say, it all began when I was invited to speak at the first annual SIBO conference, SIBOCon, that was held outside of Chicago a few years ago. And I was asked to speak on the topic of SIBO and skin diseases. And there wasn't much happening at that time that I could talk about, but I did my best. And I was asked to share the presentation with a gastroenterologist from St. Louis named Lenny Weinstock. And Lenny had done some preliminary work on this idea that patients with rosacea who are found to have SIBO and they're treated for SIBO with rifaximin have had some very dramatic improvements in their rosacea as a result of the treatment of small intestinal bacterial overgrowth. And so I credit Larry with, bringing my attention to this, and I've paid a lot of attention to it since then and lectured on it a few times. It's been one of the things that has inspired me to learn as much as I could about SIBO and to stay up to date on the developments around this issue. And although the research behind the association between SIBO and rosacea is still preliminary, the results of some of these studies are pretty convincing and have made me think that virtually every patient who has rosacea should be assessed for whether they might have SIBO as an underlying factor that might be contributing to their skin disease.
Yeah, Michael, I think there was that crossover study where they had the placebo group against rifaximin, and the rifaximin group had a tremendous improvement. And they had some pretty impressive photos in the publication. And then the placebo group didn't have much of a response at all. And then they crossed them over into rifaximin, and then that group got a huge response too. So like you, yes, we need expanded studies, but I am also really thinking, gosh, every single person that's coming in with rosacea needs to at least have an assessment for SIBO, which leads me to my next question. If you're going to attend the first SIBO con ever again, would you rather be a hydrogen gas, a methane gas, or hydrogen sulfide? What would you dress up as?
Oh, I don't like to be constipated, and I don't like to have diarrhea, so I don't know. That's a tough question to answer.
Well, it would all be gassy conversation anyway. But
Well,
I'm curious now, when you're thinking about SIBO, and this is a conversation point that I think I'd like to explore with you, just in the realm of functional medicine too, because there's so much around testing that comes up. How do you assess for SIBO? What are the clinical approaches that you think about in terms of history or maybe signs and symptoms? And when do you go to the test?
okay. Well, first, it starts out with a history, okay? And let's just take an ordinary patient that may not have rosacea. And most of those patients are presenting with a chronic history of symptoms of irritable bowel syndrome. They've had gas and bloating, they've had constipation and or diarrhea, and they have abdominal discomfort. And so when those triad of symptoms exist, or maybe two out of those three, it really puts it on my radar for assessing them more strongly for SIBO. One of the first questions I ask people is if they've ever had food poisoning, because there is definitely a strong correlation between infectious gastroenteritis provoking a case of irritable bowel syndrome, in its wake. The Campylobacter that is often the cause of food poisoning can actually paralyze the migrating motor complex in the small intestine that is responsible for the motility of the small bowel. And when you have impaired motility, then it gives bacteria who are residents in the small intestine an opportunity to ferment fermentable carbohydrates, especially, and produce gas and produce compounds that may cause constipation or diarrhea. One of the potential underlying mechanisms for SIBO is that it's a consequence of food poisoning. If they haven't ever had food poisoning, then there are a lot of other contributing factors that can lead you to suspect that they may have SIBO too. A lot of people who have IBS have, considerable anxiety, and it may be pre-existing their IBS development, or it may be as a consequence, or both, because we know that emotions have a major impact on our digestive system. And so I see, people who have SIBO frequently kind of struggling with the anxiety that comes with the unpredictability and the discomfort of their GI problem, as well as not really knowing what's wrong with them. And nobody's ever been able to tell them what's going on. And now we know that SIBO underlies the vast majority of cases of irritable bowel syndrome. And so when a person presents with those symptoms, I begin to investigate that. And the way I was trained by one of the pioneers in bringing the awareness of SIBO to not only the naturopathic profession, but to the integrative gastroenterology profession, if you will, is a colleague of mine, a naturopathic physician in Portland named Allison Seebecker. And she was inspired by a prominent integrative gastroenterologist in LA named Mark Pimentel. And the two of them, I think, are largely responsible for bringing greater awareness to the recognition of SIBO in the US. And so they both have convinced me that the best testing for SIBO is with a lactulose breath test, not a glucose breath test. Glucose is a sugar that's fermented in the upper part of the small intestine, while lactulose is fermented in the lower part of the intestine. And if you use glucose as the substrate for testing, it can result in false negatives. And the criticism is that if you use lactulose, it may result in false positives. That's true to a certain extent, but the lactulose breath test is my preference. And so the way the test is done is that a person takes a baseline sample of their breath and exhale that into a glass tube that is in a vacuum tube and captures the gas that they've exhaled. And then they take a dose of either glucose or lactulose and continue to collect breath specimens every 20 minutes over a 3-hour period. And if you see a rise from baseline in the levels of hydrogen or methane gas, in the case of hydrogen, it has to rise more than 20 parts per million for baseline. In the case of methane, it has to rise more than 10 parts per million. If you see that, then that's considered a positive breath test. And if it's done correctly, it's a very reliable way to kind of be a surrogate for the other type of testing for SIBO, which is a duodenal aspirate, which is an invasive technique that has to be part of an endoscopy. And it's fraught with potential limitations and inaccuracies too. It has to be done in a very sterile way. And most gastroenterologists do not do duodenal aspirates when they do endoscopies unless you ask them to.
On that note, I was just going to say there's an integrative GI specialist that I talk to a lot, and we were just bantering about SIBO. And like you, I also prefer lactulose because I worry, and maybe you can address this in a second, but what I wanted to say was this GI specialist, he's like, he's never done a GI, like a duodenal aspirate in years. And he's like, there's no way he would do that over a breath test if he could, just given all the precautions you have to take and the setup and everything. So
right.
It's interesting because I submitted a manuscript for publication. One of the reviewers was like, you should be recommending GI aspirates. And, you quickly realize which reviewers have clinical experience and which ones have been reading.
Right.
It becomes very obvious very quickly. So to go back to the lactulose versus glucose, is one of the false negatives that might come up with glucose is if you have a lot of motility, you'll move that glucose along the tract pretty quickly and you'll miss the bacteria that might have been present.
No, the glucose is fermented in the upper part of the small intestine and absorbed there, so it doesn't move along. Where the lactulose is fermented in the lower part of the small intestine, so it gives you a better picture of what's happening the entire length of the small intestine.
Yeah, no, I think that makes sense. Is the concern with glucose that if you have a very motile gut, would that be an issue? Or what do you think is causing the false negatives with glucose?
I think because it's only sampling the proximal part of the small intestine.
Oh, I see.
Because usually with SIBO, people have a hypomobile state. They don't have a hypermobile state.
Exactly. And I wanted to go back to that, Michael, because you mentioned something kind of in passing about the whole issue of anxiety, for example, that has some association with that, because at the root cause of this problem is motility of the gut. Also some imbalance in acids as well, but all that changes the environment. And we talk a lot about the gut microbiome and its relationship to our brain, right? And to our skin. And this is such a core phenomena that our bacteria that live inside our gut are so sensitive to every change that happens in our body. And so stress can easily be a trigger for SIBO, for overgrowth of the wrong bacteria in the gut. And that brings back this whole idea of trying to take a deep breath and just, reactivating the vagus nerve and kind of getting all that rest and digest kind of interaction in our gut to regulate. And we think about it as, okay, we're just going to digest better, but it never really rang true to me until you said that actually it's very intuitive when you think about it, that the bacteria actually are going to regulate and go back to their normal balance and allow us to really kind of digest normally, but also affect all the problems that come with SIBO, and rosacea being one of them, but also, as you mentioned, irritable bowel syndrome. So again, you kind of mentioned in passing, but I think it's fascinating that connection. The gut microbiome is so sensitive to every change, and we can see the symptoms right away in many, many people. And to go back to your testing, just like you, I try to test a lot of my rosacea patients. And I know that I, for example, use a lab that we have because our GI service, who's right across the hall from me, can offer that. But for folks who are not in a university center, where do we send people to get tested for that? Or is that something you can do in your office?
It is something you can do in your office. I do it in mine, testing analyzers right across the hall from me in my same office.
That's easy.
Yeah, just in the hallway of my office. So I just did a test this morning, and the patient had high baseline methane. And I thought, oh, she's going to have methane SIBO. It's called intestinal methogenic overgrowth, IMO or EMO, as opposed to small intestinal bacterial overgrowth, which is the proper way of defining hydrogen positive SIBO. So her hydrogen levels were low at baseline and the first 40 minutes of her test, and then they popped up. So she had a combination of both hydrogen and methane SIBO. So there are a number of labs that are available to do this. National University of Natural Medicine in Portland, Oregon has a SIBO lab. I used to order mine there before I got my own analyzer. The analyzer costs about $15,000. It's made by a company called Quintron. And so because they support naturopathic medical residencies, they gifted my office with an analyzer that, I've used hundreds of times now. And so I do it myself, but they have a good lab where you can get it done there. And I know that there are numerous other labs. I think the PowerPoint that I sent you has a list of them. So they're widely available. But if anybody who's listening would like to get in touch with someplace where they can do SIBO testing, they can simply email me, and I'd be happy to send them the list or make a recommendation. There are some labs that don't really do it in the right way, so you have to be a little careful in where you send.
Yeah, I was going to add that there's also a new test that got cleared from Trio Smart, and they look for hydrogen, methane, and they also are now assessing hydrogen sulfide.
Right.
I think it's so early, so we're trying to understand what is the role of hydrogen sulfide. But it's fascinating, Michael. We keep growing the science in this area.
Let me just comment that the Trio Smart test was developed partially by Mark Pimentel at Cedars-Sinai in Los Angeles.
Yes, right,
Yeah.
exactly.
And so that's a very reliable place to send specimens to. Well, actually, it's the Trio Smart. It's not directly to him, but it's to a lab which is affiliated with Cedars-Sinai.
Yeah, and actually, thanks for pointing that out, because the collections are very easy. Hadar, you were mentioning this. You just order the kits, you put them into baggies, and you send them in. You don't need any equipment. The drawback is you don't have the equipment. You have to wait for your results. You can't just get your results right there, then and there. But that being said, now I have a question for you, Michael, on SIBO, a little bit more here. In SIBO, of course, we think about the bacteria. What is your opinion on this whole notion with SIFO, with small intestinal fungal overgrowth, which seems to be peaking up in some conditions like psoriasis, as an example? Because a lot of the microbiome testing that's been done has been largely 16S, doesn't even look at the yeast or fungi. Now that's shifting as we go towards whole genome sequencing. Do you think these tests can pick up on SIFO? And are there situations where if you have a negative test on a SIBO test, do you still look at the symptoms and say, hey, I still am going to address this in, whatever your protocol may be, or maybe address the potential for SIBO to still be present in the face of a negative test?
Well, the first answer is that breath tests do not pick up SIFO, and yeasts are very difficult to quantify and to recognize as a cause of GI distress. We have yeasts in our gut normally in certain numbers, which don't cause any trouble. If there's an overgrowth, I think symptoms are often the best way to come to that conclusion that there's an overgrowth of candida. For example, if a woman is having chronic vaginal yeast infections, that's probably the classic example. So I have had many female patients with SIBO who have had recurrent yeast vaginitis, and when I've treated them, for that, either with nystatin or some other anti-yeast, antifungal, then, they have benefited from that. So I think it's often a concomitant problem, maybe not often, but sometimes a concomitant problem to SIBO. But I think that it's also, to a certain extent, a holdover from this kind of idea, this fad idea that candida overgrowth was responsible for so many health-related problems that, back in the early 80s, the idea that yeast was, a major contributor to human disease was very prominent. And, I thought that it was widely overdiagnosed. And we just don't have any really good ways of verifying whether there is, in fact, a yeast overgrowth.
Yeah, I just wanted to follow up on that and say, I think your point about trying to address the fungal elements is such a good one, because when I'm thinking about protocols, if you think of rifaximin, of course, that's just antibacterial. I will add in other antifungal agents. I'm curious, do you incorporate herbals when you do this? I will incorporate things like neem, or at least there are some other herbals that come out of Ayurvedic medicine too that have good antifungal activity that I'll also include as part of a regimen as an adjuvant if I'm trying to address SIBO, and I'm just not sure if there may be a component in there. Although, thank you for your comment about Candida overgrowth. I think it is there for certain conditions, but it's definitely not like the end-all be-all for all disease.
Yeah, there's a couple herbs that are widely used for the treatment of SIBO that are also very anti-yeast and antifungal, namely allicin, the garlic extract, and also oregano oil. So you can kind of address both potential problems if you use one of those as your antimicrobial treatment for SIBO.
That's funny because that was exactly my question. I wanted to ask you about changes and herbs that you can take in, but perhaps also certain foods, because it does make sense, right? If there's imbalance in the bacteria, and say you can change the motility issue or the acid issue, a diet is something that makes a lot of sense. Are there certain protocols that you utilize that exist in literature you're aware of?
The most common one for addressing people with SIBO with dietary counseling is the FODMAP diet, which is a low fermentable carbohydrate diet. And teacher, Dr. Seebecker, did a modification of a low FODMAP diet with a specific carbohydrate diet and calls it the SIBO specific food guide. And that's primarily what I follow. It's available online through siboinfo.com. That's her website. It's also available as an app, a free app that you can get for your phone, the SIBO specific food guide. So I like that. One thing that I always tell my patients is that these are just guidelines, that there are certain foods that are good and bad. Some of the good foods may aggravate certain people's symptoms. Some of the bad foods may be tolerated. And so it's kind of like you got to use your common sense. And if you tolerate a food okay, then you can eat it, even if it's supposedly not supposed to be good for SIBO. If you don't eat it excessively, it may be okay. Because following a restricted diet for 3 months or more is not easy. And so I try to work with my patients so that they decrease the number of fermentable carbohydrates in their diet, while at the same time don't lose too much weight and don't get too unhappy by being on a restricted diet. It doesn't have to be too restrictive. There are some really good SIBO cookbooks that employ a lot of foods that maybe some of us aren't familiar with, that can really broaden the variety and diversity of foods in the diet when somebody's trying to overcome their SIBO.
You know what I love about your take on this, Michael, is that you see that there's gray area in medicine. Hadar, I mean, isn't this so true? You sit there and you read a textbook, and a lot of the medical students, and this is especially, I think, rampant amongst, in residency, even with Western protocols, you just think, I read it, so that's the way it is. And then what's funny is before you went into medicine, you're like, well, I'm not sure, and this and that, and you try to, and then after you go through medical school and residency training, you have more knowledge, but you're still at that point where you're like, well, I'm not sure, maybe this will work, and maybe that will aggravate you, but now you have evidence behind saying this has a higher chance of aggravating you. But I mean, Michael, your point is so good that there's no black and white here. It's like, if it works, then it's okay. But if it doesn't work, then maybe it's an issue. And I love that common sense approach. It's like, that's how medicine is truly practiced at the end of the day.
Michael, I love how you applied it to diet, because it did cross my mind many times that while some diets you may need to be very strict with, in general, we're trying to repair a balance. And to think that you can repair an imbalance with some kind of a total abolishment of one nutrient versus the other seems to be a bit irrational. It's more about restoring the balance, adding diversity. That's a key word, diversity, to your diet. So all the bacteria kind of return to their organic balance. And so I love that. This is as a follow-up to Roger's comment that really it is rare that you probably need to have this catastrophical, categorically exclusive diet of one thing. I really think it's a catastrophe to the gut if you just introduce the same foods all the time.
Yeah, I think one good example of a diet that you need to be really compliant with is a gluten-free diet. If you have celiac disease, you don't have to be
exactly.
told. You don't have to be told to avoid gluten because you feel horrible.
Yeah, good point.
Exactly. But even these patients will tell you that they can tolerate some gluten. It's not a total kind of diet. So, but if some, I guess, are very sensitive. But the point is that it's a spectrum. There's a balance, and you can sometimes not just follow every single letter in the textbook, as Roger was saying, because when you practice, this is real live biological systems that, by the way, change day to day and within a day. And so, Dr. Traub, I want to thank you for joining us today. This was a fantastic conversation, as all conversations with you are always. Thank you for your insight into SIBO. I'm sure that a lot of our listeners who were wondering before how to utilize this knowledge now maybe have a bit of an understanding on how to approach this. And
well, Hadar, he has a textbook.
Yes,
there's
of course.
A textbook. So, Michael, can you tell us about your textbook on SIBO? Before we wrap up here.
It's not a textbook, it's a handbook.
Oh, okay. Well, there's text in it, so
There's text in it. Well, yes, Michael, why don't you tell us about the handbook on SIBO that you authored? Because I think it has a lot of great information there for our listeners.
Yeah, yeah. Well, it was produced by me for a nutraceutical company that I consult for called Nutritional Fundamentals for Health. And they have a number of what they call clinicians' handbooks. And they asked me to do one on SIBO. And so what I did actually was an informal review of the current state of the literature on the subject. And it was really mind-opening for me because I think that my training in how to approach SIBO, both diagnostically and therapeutically, was really biased by the people who I had learned from. And they didn't include a lot of information that I found when I did a pretty comprehensive literature review. One of the things, as an example, was that the most common contributing factor to SIBO is hypothyroidism. And it makes sense because when people are hypothyroid, the bowel is sluggish and
yeah, that makes sense.
bacteria can sit around, have parties, and ferment gas. So that was something that I'd never come across. And that it's a very strong correlation. So if you or any of the listeners, want a relatively up-to-date, I wrote it in 2020, up-to-date kind of survey of the entire existing literature on SIBO, then that handbook is available for free through Nutritional Fundamentals for Health. If you contact them directly or somebody who distributes their products like FullScript or Evolving Nutrition, you can get copies of the handbook that way.
Absolutely. And hopefully we can post a link or some resource with this podcast. Dr. Traub, once again, thank you for joining us. Always an enlightening conversation. Thank you for your expertise and time. Thanks.
My pleasure. I'll talk with you both again very soon.
Hey, Raja, do you know where the integrative medicine movement started?
According to Google, since Google knows everything, Dr. Andrew Weil founded the Center for Integrative Medicine at the University of Arizona in Tucson back in 1994. Why do you ask?
Well, you know how we always try to get to the root cause? I think we need to go big for the fifth annual Integrative Dermatology Symposium. How about we do this? Let's meet at the Los Ventana Canyon Resort in Tucson, Arizona. Or you can join virtually from September 30th to October 2nd and hear from the world-renowned experts like Andrew Weil.
Exciting. And our theme is connecting mind, body, and spirit to take a more holistic approach to our patient care. What do you say?
Absolutely. I mean, where else can you get the latest on diet and dermatology, hypnosis, botanicals, common diseases, aesthetics, and other unique topics in dermatology with practical takeaways to start using in clinic right away?
So true. And let's not forget, we've got the new track for estheticians too. I think I'm going to need to call in a sick day or two before the symposium so I can enjoy the waterfall and trails on the resort, stargaze, play a round or two of golf or tennis, relax at the spa, and catch up with colleagues at the evening receptions.
Yes, that place is spectacular. Use our discount code POD25 at checkout for 25% off.